In cases such as compartment syndrome, immediate wound closure may not be indicated. Southmedic's dynamic tissue systems are placed early after surgery to prevent further retraction and keep the wound edges mobile until such time as a delayed primary closure is possible. The devices exert a moderate dynamic tension continuously on the wound. Left alone, wound edges become granulated and fixed in an untensioned, retracted position. This state is increasingly difficult to reverse. Application of moderate appositional forces recreates the tension of intact skin in its natural state. The system is gentle enough to adapt to patient movements, maximizing comfort and reducing recovery time. The wound edge remains mobile and granulation is minimized. Unrelenting moderate tension is essential for retraction prevention after a fasciotomy. With early application and diligent adjustment of the devices, additional surgeries are avoided and delayed primary closure can be achieved sooner.